people ask me all the time, is it my thyroid? And if you have to ask that question, is it my thyroid? Then it probably is. So one of the things that happens in traditional medicine is that there is what's called a bell curve. So there is a range from what we call normal. And in this range, if you fall in that range, the doctor's going to say you're normal. But what happens when you fall just kind of right here? Or what happens when you fall kind of right there? Well, we call those kind of functional ranges where you're functional here, but you're not so functional here. And that's where the whole term functional medicine comes from. So doctors who do functional medicine look at not only these numbers, these lab numbers, and I always say that the blood doesn't lie, but we also look at the ranges and where you fall and your symptoms. How do you feel? So what are the symptoms of low thyroid? I'm going to change this pen just a little bit. So the symptoms of low thyroid, the big one, weight gain. Weight gain is huge with thyroid. And one of the interesting things about thyroid hormone is that thyroid drives your metabolism. And everybody knows your metabolism is what determines whether you are a healthy weight or whether you're overweight or underweight. So when we look at thyroid, we have to ask ourselves, if you're gaining weight, is your thyroid functioning? Is your metabolism functioning? So, I have people all the time who say, I don't eat that many calories and I don't understand why I'm gaining weight. Well, it's your hormones. If you are really not just like eating donuts and cake and cheeseburgers every single day, if you're overweight, you've either got an issue with your thyroid or you've got an issue with your insulin, your blood sugar storage hormone, by definition, because the way you distribute your fat makes all the difference in the world. So when I'm helping people understand how to maybe change their eating habits or how to look at their hormones, I look at where you distribute your weight. And so if you distribute your weight kind of in a boxy sort of way, and so like you gain weight all over, but it's kind of boxy looking, that's more of a thyroid distribution. Whereas people who have an insulin issue will be kind of like the Michelin man. So if that's you, that's more of an insulin issue. So if you have this body type and you're distributing your fat that way, you're gaining weight and you have other symptoms of low thyroid, like maybe you have a little bit of hair thinning or hair loss, or maybe you have dry skin. Constipation is huge. Because think of everything being slow, low being slow, constipation, and then maybe you're just tired. Tired is huge. Tired all day long, not just tired when you wake up in the morning, but tired all day long can be a huge symptom of that as well. Maybe your nails don't grow as well. There's all sorts of things that can be associated with thyroid, but usually it's going to be weight gain and tired. So all symptoms of low thyroid. Now, if you have insulin issues, insulin and thyroid are very closely related and they sort of mimic their receptors. So you can have a little bit of crossover with both. So a lot of times I'll tell people, get your insulin level checked and your thyroid levels. So when you get your thyroid levels checked, not only do we look for these kind of outliers kind of on the low normal or the high normal, but we also want to check all the thyroid hormones. So I'm going to do kind of a quick little anatomy lesson because those of you who are suffering with potential thyroid issues, I really think that you probably need to know this. So if we were to draw our person again, there's a gland in the head called the pituitary. And then your thyroid sits in your neck. So if you were to feel your neck, you can kind of feel, especially a lot of women, especially that come into my practice, who have enlarged thyroid glands, you can feel what's called a goiter. So I'm going to give you a little history lesson on iodine here in just a second. I'm going to explain what the goiter is. So the thyroid is just a big gland that produces your thyroid hormone. And so when it's overworked, it gets enlarged just like any other muscle would. If you worked out in the gym, if it's overworked, it gets bigger, right? So the thyroid sits in the neck. And the pituitary, when you get your lab tests done, and I always say one test is no test because, like when I was in x-ray, if you got a broken or a hurt leg fracture in the bone on the side view, right? 3D. So you could miss it. So the radiologist would yell at us and they'd be like, one view is no view. It's the same way with thyroid labs. One lab is no lab. You have to check a whole panel to understand what's going on. And a lot of traditional docs don't get this. I'm going to show you why. The pituitary makes a hormone called TSH, or thyroid stimulating hormone, which tells the thyroid to make more or less. So when this is high, that means your thyroid's actually low, and when that's low, your thyroid's actually high, or what we call hyperthyroid. So the discussion for hyperthyroid, some of the patients I see with weight gain and fatigue aren't really dealing with high thyroid. So that's another kind of potentially autoimmune condition. So I'm not going to really go into high thyroid. I'm going to focus on the low thyroid. But what happens is usually this number will be high, so the TSH will be high, and the thyroid will be low. And this range is anywhere from about 2 to 4. And it used to be that if you were at 10, they would start treating you with thyroid hormone, and the American Endocrinology Society has lowered that to 5, and now they've lowered it down to 4. So they change it according to people's symptoms of what we call, who do we call normal in that bell curve anymore, right? Because everybody's got thyroid symptoms, and there's lots of reasons for that. And I'm going to go through that in just a second. But the thyroid makes a hormone called T4, which then gets converted to a hormone called T3. And a little nerdy science, T4 is called T4 because it has 4 iodine molecules on it, which then gets converted to T3. My biology, my organic chemistry is really terrible here, but has, guess how many iodine molecules on it? Hey, you guys are smart. 3, right? So there's an enzyme here called peroxidase that pulls one of these iodine molecules off to make T3. And T4 is almost completely inactive. Doesn't hardly do anything in the body as far as for, constipation or fatigue or energy or metabolism, weight. And so this really isn't an active player. T3 is the active form. I like the analogy that this is maybe not completely inactive, but maybe it's like a little red bicycle. And the active form is, what's your favorite race car? My husband likes Lamborghinis. Maybe you like Mustangs, or maybe you like Ferraris. So this is like a little red Ferrari. So T3 is where the action is. So your T3 has to be functioning for the tissues to be able to do good metabolism. T3 is also considered in the DNA where the Krebs cycle happens, where respiration happens, where metabolism happens. So this is your DNA. There's something in there called AMPK. And AMPK is the pilot light of your metabolism. Pilot light. And you'll know what happens when your pilot light goes out, right? You don't have heat for your water, right? So if your pilot light is out in your body, you don't have that heat. You're cold all the time. Oh, I didn't mention cold hands and feet. Now, cold hands and feet are a little bit tricky because if you're a perimenopausal or a menopausal female and your estrogen starts to decline, you start to have hot flashes. So temperature regulation is a little wonky. So you may be really hot from your hot flashes but have cold hands and feet. So temperature is not always a great indicator of low thyroid, but it can be for sure. And in fact, Dr. Wilson, who wrote Wilson's thyroid syndrome, actually recommends that people check their temperature in the morning. And for years and years, when I had low thyroid, I was cold all the time, and it was interesting because when I was a little kid, I had thyroid issues probably for many years. I remember I could never get a fever, and even when I was sick. And so, like, a fever to me was literally like 98.6, which is where most people ride. So that kind of sucked when I was little, and I wanted to get out of school, and my mom would check my temperature. So usually people can't even get up to like 98.6 when they have low thyroid because heat generates kilocalories, which burns calories, right? That heat. So you need that heat to be able to be generated to lose weight. So all of that's found here in this active T3, which stimulates AMPK, or the pilot light in the DNA. And so a lot of times, a lot of traditional doctors kind of give me grief when I put a patient who has normal thyroid levels on a little bit of T3, because what I'm trying to do is activate their pilot light, essentially. And so there's tons of research on AMPK. If you go Google that and thyroid, don't take my word for it. Do your research, learn about this stuff. It's all out there. But traditional medicine just wants to put you on drugs. And so then we get into these problems with, you think things are working properly, not. So I want to talk about that just a little bit. So traditional medicine, and I won't talk about all the shortcomings of traditional medicine, and I am a family doc. I'm a traditional trained doc in an MD residency program. So I get it, but what I found was that basically they just taught us how to write pharmaceuticals. They didn't really teach us all of this physiology and good medicine. So what happens is the pretty little drug rep comes in from the Thyroid company, which is synthetic thyroid, and Thyroid is just T4. Now mind you, that's the inactive form. So the doctor says, okay, your TSH maybe is a little bit high. If you're lucky, your TSH is high, and they'll say, okay, we'll put you on some Thyroid. So they put you on the lowest dose possible because they're all scared, and they also don't know how all this works, so they're not really maximizing your thyroid because they're afraid that they're going to like cause side effects or something, which you can if you don't know what you're doing. So they put you on this little low dose of Thyroid, which then suppresses the TSH. It makes that number go down, which makes them think that the thyroid is functioning. So you have what's equivalent of a normal T4. But remember, this is the inactive form, so this will feed back all day long with the pituitary. The doctor will check your thyroid levels, and the doctor will say, oh, you're just fine, but you're gaining weight, you're tired, you feel like crap, and you're like, no, it's not fine. In fact, one time I was at this Halloween party, and there was this woman who I like to say is not overweight, but under tall. She was literally like wider than she was tall, and she's like telling me, she doesn't even know what I do. People just tend to talk about medical stuff all the time because there's so much dysfunction in our physiology that traditional medicine doesn't address. So she's like, yeah, I'm on thyroid medicine. I finally got the right dose, and I'm really happy. But she's like really, really overweight. And I'm like, honey, I'm thinking you do not have the right dose or you would not be overweight. So what's happening is her doctor has checked blood levels, put her on this synthetic thyroid that's suppressing her TSH, and convinced her that everything's just fine. But she knows on some level that everything is not just fine. So there are other choices, and what I like to use are the natural thyroids, like the MP thyroids or the Armour thyroids. Why do I like those? And why do traditional docs not like them? Well, traditional docs don't like them because with Thyroid, they can monitor the TSH and they can pat themselves on the back and feel really good that their numbers are working, but the patient doesn't feel better. So if you put somebody on Armour or MP thyroid, which is the natural form, the bioidentical form, it's also T4 and T3. Now the traditional docs don't like that because they don't know how much T4 and how much T3. It's just desiccated pork thyroid basically, and there's some non-pork based thyroids, so if you have a problem with pork, we can use like the MP thyroids and things like that. But basically they don't know what they're getting, so the TSH suppression is not right. But I don't care what the TSH suppression looks like, I go by how the patient feels. So I love Armour thyroid, I love compounded thyroid, which is special dosing that you can pick how much T4 and how much T3 the patient gets. And most people don't need a lot of T4 because it's their conversion that they pull iodine off that matters. So, you know, it's interesting in our country, about 50 or 60 years ago, they used to put iodine in the bread, and then they started taking out and put bromide in the bread. And then, like with the fluoride in our water supply, which displaces iodine, kids started getting overworked thyroid glands because they didn't have enough iodine to make T4. So the thyroid gland just kept trying and got overworked. So you know where they put the iodine after that when they were trying to fortify or supplement iodine, they put it in the salt. Well, if you avoid salt because of blood pressure issues and things like that, you're probably not getting enough iodine. Interestingly, thyroid impacts not only the metabolism, but your cancer rates. The women in Japan who get plenty of iodine have almost no fibrocystic breast disease, almost a non-incidental rate of breast cancer. It's amazing. So iodine is very important, as is vitamin D. So I won't even go into all the things you can do to reduce your cancer risk. But thyroid is really important, and iodine is really important. Now here's the kicker. You can't just go out and get iodine supplements, because if your conversion to T3 through this peroxidase enzyme is not working properly, then you're going to have too much iodine buildup, and that can make you feel worse, anxious, heart rate, anything that's besides low that makes you go high, makes you speed up, can make you feel really anxious and wonky, so you don't want to just take iodine. So there are blood tests you can do against autoimmune. Autoimmune means your body kind of fights its own thyroid, and there are autoimmune antibodies you can check against this conversion enzyme. You can check a T4 level, you can check a T3 level, you can check TSH level. You can check our reverse T3, which shows you if this is functioning, and you can do percentage rates and see how all this is converting. One of the biggest things that you can change in your diet today, if you have autoimmune thyroid, or if you have known Hashimoto's or any thyroid issues like that, or you just suspect that you do, it's something that you can try, is that I won't even get into leaky gut, but this whole premise of leaky gut, inflammation in the intestinal tract caused by different foods. One of the main foods that can cause this is gluten, which is also connected to pesticides because they put pesticides on the wheat supply, and I won't even go into leaky gut. But gluten can actually trigger something called zonulin in the leaky gut, in the gut, and the zonulin that's trying to repair the gut actually can block this peroxidase. So you can't make your active T3. So if you have a doctor who just checks TSH, you'll never know if you have active T3 available to you or not. So in a nutshell, that's thyroid. That's kind of how I look at thyroid, and thyroid can make a huge impact with people. But you have to look at their symptoms. You have to look at all the labs. You have to look at the functional ranges in relationship to their symptoms, and you have to make a plan for them. So that's what I do in my day job. You know, one of the things that I talked in my little video I did yesterday was thoughts create emotions, which create hormone reactions. So I would love for you to change your thoughts. I'm always talking about API, assume positive intent, which is a huge movement to change your life in your thoughts, to start thinking more positive thoughts. Or emotions are harder because they're sandwiched in here. You can change the emotions, but usually the emotions change when your thoughts or your hormones change. Or you can change the hormones. So I love to check all the hormones, not just thyroid, but insulin and female hormones and male hormones, and make a plan for people to get back on track and empower themselves. Because at the end of the day, empowerment through your education is everything. Otherwise, you're just a sitting duck and you're like, I wonder if it's my thyroid. And you just don't know. So I recommend that you find a dog who can do these levels, who thinks this way, who can help you get back on track, and maybe change those hormones while you're changing those thoughts, which change the emotions, which change your world, and change everybody's world collectively when everybody's coming together feeling good emotions. So have a wonderful, blessed day. Hope this was helpful. If you're interested and you want me to do this testing for you and come up with a plan, our office number is 1-800-479-6435. You can call our number and schedule a time to sit down with me. And if you're watching this video, normally I charge $287 for a new patient visit. If you're watching this video and you mention this video, I will sit down with you and create a plan for you completely for free, free consult. Call me. I'd be happy to do that for you, and we'll come up